cancers in women in our country, I think all of us need to understand a little bit more about breast cancer. So with this, I have a small presentation regarding breast cancer in which I'll be talking about what are the signs and symptoms of breast cancer, what are the risk factors, how do we diagnose breast cancer, what are the initial stages, what do you mean by stages of breast cancer. And my colleague Dr. Kiran, he will be talking about the treatment aspect of breast cancer. With this, I would like to draw your attention towards the slides. See, before we talk about breast cancer per se, we need to understand what exactly do you mean by cancer. See, all the cells in our body means all our body is made up of something called as cells, right? The cells get something called as a signal. The body gets a signal to divide. So normally as a signal ever ahar pisod, the cell divides only once and it stops. Kintu cancer this is not the situation. In cancer, the cell is a little different, wherein the cell is getting a signal to divide, but it is not dividing just once; it is dividing continuously. So, it means we form like a swelling or a mass, and in this situation, it can happen anywhere in the body, top to bottom. It can happen in the brain, brain cancer, lungs lung cancer, breast breast cancer. That is how it is basically. And ever jodi eta jaga jodi arambho hoy jay, then it can obviously go to different parts of the body also. So what I want to highlight from this particular slide is breast cancer is not like something like an infection. Junto apni gharo eta manu cancer ase teo to ami cancer pabo pare tene ke nohai ba covid ase ba malaria ase which comes from outside. Amar gut bhitorete kisman cells junto ase tate DNA talman abnormality thake jihor karone the cells are not dividing properly. And from there they spread to other parts of the body. Unfortunately, cancer is not a very rare disease. In today's date, as per this particular data, in India, particularly as per this WHO data, we are seeing close to 14 lakh new cases of cancer, and more than 30 lakh cases are seen, over a duration of 5 years. So, which are the most common types of cancer we saw? In males, probably it is the oral cavity cancer and the lung cancer, and highlight korisu. In breast cancer is the most common cause of cancer in females. We are seeing close to 1.9 lakh cases every year. So, I suspect that breast cancer means suppose if there is a lump in the breast, that is the most common thing. When swelling is breast, it is important. If pain skin changes, nipple discharge, there is some difference in the size between the two breasts. Redness ase. So then we have to think that probably we are dealing with a case of cancer. But it is important to understand not all swellings are cancerous. Kisman young age breast swelling hobo pare. So it doesn't mean that jikono swelling cancer karne hoy bole teneke no hoy. Probably out of 10 cases, maybe 8 cases are not because of cancer. But jodi thoro keta cancer alaman boyo means at age of more than maybe 40 or 50 jodi ahe, then we need to be more cautious. Jodi kiba skin changes ase, we need to be more cautious. Eta important kotha to ki ase means cancer swelling doesn't need to be painful. Painless swelling ho pare. In our society, usually what happens is because of the conservative nature, manu jitiale besi weak no hoy ba besi kosto no hoy, jitiale doctor le apna hai. So it is very important for all of us to educate our mothers and sisters and aunt and all our family members that if you have any such swelling, you have to report to the doctor as early as possible. So apna risk factors to ki hoy, obviously pregnancy, early pregnancy jinto ase has
स्तनर जदि कैंसर होय तार की ट्रीटमेंट আছে এটো আমি জানিব কিছুমান মিসকনসেপশনস আছে ও ব্রেস্ট ক্যান্সার আছে বলি ব্রেস্ট ক্যান্সার হইছে ও অপারেশন বহুত ডাঙর স্তন কাটিব লাগিব এটো সব মিসকনসেপশনস আছে এটো আমি ক্লিয়ার করব তো ডক্টর আগে কোর্সে ক্যান্সার 40 স্টেজ আছে Stage 1, 2, 3 and 4. Stage 1 or 2 early breast cancer. Early breast cancer